When I was 35, I had surgery for gallstones. I was in horrible pain, and I thought that was normal. I remember going out of the hospital that day with my hands on my knees, walking to the elevator. It was suggested more than once that perhaps I just didn't want to get well. Now, up until the age of 35, until I had the surgery, I was pretty healthy. Never had any serious health issues. And I was in shock. I couldn't believe that with what was supposed to be a minor operation, I was reduced to somebody in agony. You know, muscle spasm that just never let up. I was in as much pain a month later and a year later as I was 2-3 days after the surgery. I was finally told, well, just push through the pain, it's not really there. So I took their advice because I thought, with all these doctors saying basically the same thing, I'll just keep going and pushing through the pain. And finally, just before the 3-year point, I was in my garage breaking down some boxes, the recycling bin. And I picked up a box and went to pull the flaps apart, and I felt the muscles all the way down the right side of my back and along my spine near the bottom tear. I was in so much pain, it hurt to breathe. My right arm hung at my side. I could not have even lifted a cup of coffee. So when I saw Dr. Kidd, it was an integrative medicine clinic. His view was, he said, if your solution is not inside standard medicine, it must be outside. He used neural therapy with me. This is something that's very big in Germany. It's kind of first line for pain syndromes that don't go away. He used cranial sacral therapy with me. The biggest tool he used with me, though, probably 2/3 of my solution, was something called orthomolecular medicine. It means straightening the molecules. What he found was nutritional problems, absorption problems, digestion problems that had left me depleted. So what he said was, after the surgery, I didn't have the building blocks to rebuild my body, which was why I didn't recover. He changed my diet radically. And I remember saying to him, I said, you know, you're suggesting a high-fat, low-carb diet. I said, this almost sounds like Charles Atkins. And he said, it's not the right thing for everybody, but for you, given your condition, he said, it's exactly what you need for now. I remember standing outside at the barbecue, cooking yet another steak, right? And I reached up, I'm right-handed, took the flipper and I flipped it over, and then I realized I was using my right hand again, right? I remember standing there with, you know, I had tears in my eyes. I couldn't believe it. So even though it was a long way off, at least I was coming up again, and I'd been in decline for 3 years. And so that was a real turning point for me. What Dr. Kidd did with me was, most of it was totally outside standard medicine. But had it not been for that, I wouldn't be here, I'm sure. I was at the end of my rope. I couldn't take it anymore. I think the doctors who have branched into alternative or complementary therapies should be applauded. I mean, that's amazing. They're going against the tide.